I think anybody that reads this psychoanalysis needs to see a psychiatrist, because I don't believe that any normal person will forcefully engage a male or female in sexual intercourse. So it's a very important issue we have to look at. And when it comes to the issue of rape,
are you in Sheraton?
We also come to policy.
Are you in Sheraton?
And that's where the advocacy comes in. What policy do we have on rape? Most of the time, we focus on punishing the offenders and all that. Yes, it's good to punish the offenders severely, but we also have to make the policy, make the social environment conducive for those who suffer rape to report it. A lot of times, people don't report it. And we focus on the offender. What of the person that was raped? The psychological trauma and everything the person goes through. Does our system have anything in place for those people? Our system forbids abortion. Yes, but we now allow someone who was forcibly raped not to have a choice of deciding if the person wants to have the pregnancy or not. So these are things we must look into. Because as the person may have STI, someone is forcibly raped, they may transfer sexually transmitted infection, and not just that, besides the psychological trauma and everything, the system expects the woman to carry the pregnancy of someone he or she doesn't know about. What of unsafe abortion? From rape, because abortion is not legal. I'm not advocating that it should be completely legal, but in certain cases, it can be made legal. For instance, the issue of rape. The person doesn't want to carry a baby of an unknown man, and he goes through the back door. I once visited a child, a student of 17 years, a very beautiful girl. She was necessary. She was raped, and she went to abort. Abortion done, she had infection, brought to the hospital. The infection became so severe from there she had kidney failure. I was working in a renal unit that time, so we do dialysis and all that. They spent so much money. The girl was from a very poor background, and eventually she died. So just look at that story. The system has failed that girl. One, she suffered rape, but don't know if anything happens to the person that raped her. Two, she had unsafe abortion, from there, entire resources waiting. These are things we should think about. These are things we should advocate about. What of child marriage became a major issue recently in Nigeria. People talking about. One thing we did is for teenagers, and not just child marriage. 2 days ago on Channels TV, they were talking about baby factories, and you were seeing a lot of young girls, 15, 16, who were carrying babies and all that. These are health issues. Health issues is not just when someone has cancer and they say they can't treat the person in Nigeria, you should go to India, you should go anywhere. Those ones are important. But it's just a minute percentage of the population that have cancer. There are so many health issues around us, which we young people can become advocates for. And one tool for advocacy is this. Just as you can use it for entrepreneurship, you can use it for advocacy. Instead of playing around, you can make your research and make your statement as a group on some of these things. The maternal mortality ratio, Nigeria accounts for about 2% of the world population. But we account for 10% of the number of women who die from pregnancy-related issues. Why should a woman die in the process of giving birth? It should be unheard of. These are issues we should think about. One of malaria that I work on. Malaria in pregnancy accounts for 11% of maternal mortality ratio in Nigeria and most parts of Africa. So why should a woman die of malaria being pregnant? I won't have time to describe the details of how it happens. But for every 10 women that die from pregnancy-related causes, malaria is responsible for 1. And malaria is responsible for 1/5 of the total child death in Nigeria. I once treated a child who has severe malaria. It got into the brain. The child survived, but he became blind at that age because malaria stopped blood supply from the part of the brain. The parasites were so many, and it made the child to go blind. We support 1,677 health facilities in the country, getting data on malaria. It's more serious than you and I think. Some weeks ago, I spoke at Social Group Summit, and what I spoke on using mobile to beat malaria. We decided to take action to do advocacy of malaria, and I think everyone here should also be part of that. If you're on Twitter, tweet about malaria, tweet about action, use the hashtag beat malaria. There is HIV, there is STI, there are a whole lot of things that affect African youth, and we need to take action. Before I end very shortly, just for those of us who are from certain parts of the countries, if you are from Niger Delta, environmental pollution is causing lots of health damages, and you can be a voice. You can be a voice in your hometown. It's causing people don't have good water to drink. It affects their health. The petroleum makes them to have some kind of diseases. You can advocate for action to be taken on this. If you are from Zamfara State or you are around the lead poisoning, it's killing a lot of children. These are issues we young people can forget about. If you are from Ghana, I don't know if there's anyone there. There is a place that are doing illegal gold mining. Yeah. And some of my friends from there, we talked and we just discussed how you did that. I am.
Yeah, just wait for me. I'm videoing a session. Just wait for me. Come inside where the Ministry of Youth is doing a program.
Gold mining to do some stuff. And will also cause
youth.
Environment, climate change.
By your left side.
Peace, crisis. Yesterday I returned from Yola. Adamawa State, the state of emergency there. In the last 1 month I've been there twice because that's part of the state we are working. There are some areas, one of the officials were telling me that the insurgents, the terrorists go over to the village, close to their boundary with another Borno or Yobe State, and health workers are targets. So health workers deserted the village, the hospitals there, the health facilities are not working. So we need peace to have health. So when you are advocating for peace, you are also doing advocacy for health. And we need peace not only in Nigeria and most part of Africa. Lastly, health advocacy, that's health system strengthening. Our government, in some levels, there are some governments among states who are serious, but there are some who are not. Think about your government, think about your community. Health is on the concurrent list. Federal has a job to do, state has a job to do, local government has a job to do. What are each of them doing in your community to promote health, to stop people from dying from unnecessary causes? Think about this, do advocacy, and that's where it comes to good governance. When there is good governance, when there is peace, you have good health.
Yeah.
So, thank you so much. Like a couple of days ago,
just wait for me. Just wait.
African medical students in Ghana, and one of the decisions we took was that using the tool of medical student associations, I was once the head of African medical student associations while I was at school, to reach out to the communities that you have medical schools. Every medical student association should do advocacy in communities, do outreach. If you have any group, if you are students, think of what your student organization can do for those communities that are related to health. That's part of the advocacy. So, and in Togo, there are also some young people are doing something to establish HIV clubs in the University of Togo. And these are things people are doing around the place. And there's a guy in Botswana who was also working on. So there are many people everywhere. There are so many things you can do. Just start doing something. Okay, let me just end with that. Just start doing something. You can take action, and the time is now. Thank you so much.
Just start doing something. The time is now.